Item number SCP-899. Object Class Euclid. Formerly safe. See Incident Reports. Special Containment Procedures. SCP-899 is contained in a rough patch of forest in Rocky Mountain National Park. The SCP-899 phenomenon has not been able to travel more than 5 meters beyond a standing living tree. Thus, the area has been isolated by creating a continuous fire break around the affected region. 3 Park Service cabins are staffed by Foundation agents in the borders of the site for the purposes of preventing hikers and travelers from attempting to enter SCP-899. Agents who are authorized to administer Class B and C amnesiacs to any trespassers. Children who enter SCP-899 cannot be recovered, and containment must be maintained by removing those who have knowledge of the child's last whereabouts or by planting false evidence of death by natural causes elsewhere in the region. Agents who come into physical contact with SCP-899 must undergo regular physiatric evaluation. As the SCP-899 phenomenon has become increasingly more violent, all trees within 5 meters of the observation cabins have been removed. Personnel entering SCP-899 must do so in pairs and carry a sidearm with custom iron ammunition. Description: SCP-899 is a psychic and telekinetic phenomenon that most commonly manifests as groups of hostile phantom children. Travelers in the area have reported being persuaded and harassed by small shadowy figures that curse and throw rocks at and attempt to drive them out of the immediate area. The figures tend to be featureless, and it is usually failure to leave the area will increase of aggressive behavior, accumulating in a direct physical attack by the entities. An adult who comes into physical contact with one of the entities will suffer a loss of all detailed memories prior to their onset of puberty. General knowledge of family members and living conditions will remain, but persons who have been affected by this memory loss often display a significant change in personality. The most common symptoms are loss of impulsiveness and curiosity, and negative responses to attempts at humor. Affected persons who tend to become highly impatient with children regardless of their prior behavior. Pre-adolescent children who come into contact with entities will physically disappear, after which some or all of the entities may take on parts of the lost children's appearance. No attempt to communicate or find the whereabouts of a child lost in its way has yet been successful. Adolescents who have not fully matured past puberty are dead expunged, although more detailed manifestations have been encountered within the area. No attempts to communicate with the entities within SCP-899 have resulted in anything but attacks on Foundation personnel. Items made of iron or redacted are useful in warding off direct contact with entities. However, as confrontation of the phenomenon has not required to contain it, no tools containing redacted have been allocated to SCP-899. Travelers through the area is also hindered by a special anomaly that makes land navigation difficult. Compasses and GPS navigation systems will give false directions, and trails through the underbrush will change the course. Although there are occasional sounds of wildlife within the affected area, no wild animals or tracks have been observed within the range of SCP-899's effect. Animals brought into sight are also subject to attacks by the entities, although they will not attempt to make physical contact. Experiment 899-1. Conducted March 23rd to May 15th, 2009. SCP-573 was transferred to SCP-899 to test its effect on the childlike manifestations. SCP-573 was successful in driving away the manifestations, although the spatial anomaly that complicates land travel within the area remained. Due to the harmful effects of prolonged exposure to SCP-573 was returned, and containment at the conclusion of the experiment. SCP-573 should be contained here with SCP-899, as they can effectively be used to cancel each other out. There are no children or animals to be exposed to SCP-573. Instead, this place. Please reconsider and return the 573 to my care. Agent W. Incident Report 899-25. June 10th, 2009. A new manifestation was encountered in SCP-899. The entity took the appearance of an adolescent male covered in bloody wounds. Rather than the normal interaction with it, it immediately attacked Dr. Blank, resulting in severe lacerations and distinct bite marks on the arm, neck, and upper thigh. Dr. Blank is undergoing treatment in quarantine. Incident Report 899-26. June 13th, 2009. Dr. Blank is released from the quarantine with no permanent damage beyond scarring. Dr. Blank passed the psychiatric examination with expected results and has been able to give detailed recollections from his youth despite physical contact with SCP-899. The new manifestation has been classified as SCP-899-1. Incident Report 899-27. June 20th, 2009. SCP-899-1 manifestations have been increasing in number and have also been observed in direct conflict with other manifestations of SCP-899. SCP-899-1 is also attacked the cabin with northern border and started a fire, which resulted in the death of Agent W. Although SCP-899-1 can be deterred from the same manner as SCP-899, their new manifestations display a significant increase in aggression with intent to kill. Research suggests that the charge in SCP-899's phenomenon is related to the exposure of SCP-573. No further cross-SCP experiments with SCP-899 is allowed at this time, per 05 order.